Hello, my name is Lisa, and I'm doing my presentation over privacy and security issues in public health. Public health defined. With the rapid evolution of technologies, standards, and partnerships, new opportunities for monitoring and improving population health have been created with the goal of preventing injury and disease, while health informatics concepts strive to limit health problems and promote health. It comes as no surprise that public health has taken a massive beating since the known emergence of the novel coronavirus, or COVID 19, in the United States in late January 2020. Somehow, it seems that this newest outbreak still leaves us questioning, was enough really done in time to mitigate the massive and rapid spread of COVID 19? Autocratic regimes. Frederick Burke, in his guest editorial Declining Public Health Protections Within Autocratic Regimes, discusses how a substantial number of nations are ruled by autocratic regimes who have characteristically failed to adopt investment in public health infrastructures. China, for example, specifically in Wuhan, Hubei, where COVID initially broke out and where the gravity of the virus was known by President Tsai. However, initial reporting to the World Health Organization about the presence of this viral pneumonia was delayed. Moreover, anyone who attempted to reveal any details surrounding the outbreak were arrested, jailed, and punished for breaking their silence. In countries like North Korea, while their borders are closed to all and North Korea remains a sealed-off country, they ceased all communications regarding COVID-19, denying any existence of cases and/or deaths associated with the virus outbreak. Both aforementioned countries have been known for their autocratic and authoritarian leadership styles, and Burke argues that because of this type of narcissistic approach to leadership, the monitoring of public health concerns and efforts to slow and prevent the spread of infectious disease are severely stunted. The United States, likewise, our leadership is proving to be increasingly authoritarian, which poses a major threat to public health, predominantly in the fight against communicable disease. Most notably, no matter who you are or where you stand politically, President Trump initially took a more autocratic approach to dealing with the outbreak by insisting that cuts be made to the CDC, NIH, and Medicare spending, specifically in the area of communicable disease, resulting in a delayed response to the public health crisis. The president has also been openly oblivious to the current status of emergency medicine departments in all hospitals, rural and urban, forcing patients to remain in emergency departments until critical care beds open. It stands to reason that it was in fact obvious from the onset of the COVID-19 outbreak that our infrastructure was not designed or equipped for an outbreak of this magnitude, and it is arguably safe to say that our leadership and their lack of planning and acknowledgement of how serious the outbreak was early on has been a major contributing factor to the public health crisis we now face. Tools of success. An analytical study done over 128 countries looked at the three measures necessary to control public health risks: prevent, detect, and respond. What they found, using the State Party Annual Reporting, or SPAR tool, was that while there was a wide variation between each country's ability to prevent, detect, and respond, only half of them were shown to be operationally ready, suggesting that the response capacity was in fact present. So why then has the outbreak been so devastating across the globe? Kandel et al. Argues that there are many factors affecting the emergence and spread of infectious disease outbreaks, and that a contributing factor could be population density or crowding. Another factor that was likely overlooked in trying to understand the nature of a rapidly spreading infectious disease was the more vulnerable populations of people based on socioeconomic status, comorbidities, and a lack of sufficient health infrastructure. Infectious disease outbreaks have been emerging increasingly over the last 4 decades, and the warning of a large-scale pandemic have been around, and while efforts to improve diagnostic capabilities plays a role in the preparation for and response to these outbreaks, we must consider the human and political influence on its spread. Because of the inevitability of infectious disease outbreaks, healthcare systems and institutions need to ramp up their prevention and preparedness plans by organizing beds and isolation rooms, and providing more education surrounding the spread of infectious disease needs to be part of standard infectious disease nomenclature. If the outbreak of COVID-19 has taught us anything, It is that infectious disease does not discriminate, and their ability to travel across the globe in a matter of hours is extremely realistic. The US went from a dozen cases of COVID 19 to more than 1,000 in less than 24 hours, and the number of cases continues to rise and aggressively spread. Personal hand hygiene should be and should have always been a measure taken in everyday life, and testing efforts should continue for the foreseeable future. Now is not the time for political agendas. Now is the time to accept that COVID is here to stay, and if appropriate measures are not taken, it will have a lasting and devastating effect on not just our economy, but our entire human race. Thanks for listening.